Hello everyone, welcome to my channel. My name is Kanika Arora and welcome to my channel The Medical World. In our today's video, I will explain you about the safety and health precautions which is used in the hospital and in our daily life. So this will be very useful video for you. So let's start the video. First one is the isolation precautions. What is isolation precautions? Isolation precautions create the barriers between people and the germs. These type of precautions have to prevent the spread of infection in the hospital. You can see this sign. This is the sign of the isolation room, that is to stay away from it. So it mainly act as barrier between the people and the germs so that the crowdy people and the crowded area should be avoided at that place. You can see this sign on the screen mainly in the hospital. If anybody who visit a hospital patient who has the isolation sign outside the door should stop at the nurse's station before entering the patient's room. The number of visitor and staff who enter the patient's room may be limited. Different type of isolation precautions protect against different type of germs. Next one are the standard precautions. When you are close to or handling the blood, bodily fluids, bodily tissues, mucous membrane, or open skin, you must use the PP, that is personal protective equipment. Follow the standard precautions with all the patients based upon the type of the exposure expected. Next one are the PPE. You can see on the screen the picture of the PPE, that is the face shield, N95 mask, gloves, and isolation gown. Okay, and it includes gloves, mask, and goggles, apron, gowns, and shoe covers. Yes, it is the new thing that shoe covers is also included in the PPE. It is also important to properly clean up afterwards. That means that gown, if the gown is disposable, you have to keep that in garbage. But if the gown is of the second clothes, then you have to keep that in the recyclable garbage. Next one are the transmission based precautions. Transmission based precautions are extra steps to follow for illnesses that are caused by certain germs. Transmission based precautions are followed in addition to the standard precautions. Some infections require more than one type of infection based precautions, and patients should stay in their room as much as possible while the precautions are in place. They may also need to wear a mask when they leave their rooms. Next one is the droplet precaution. It comes under the transmission based precautions. Droplet precaution includes the wearing of the mask, that is, we have to prevent from the droplet infection. For example, I have told you, if you are not wearing the mask and you want to sneeze or cough, always use inside of your elbow and then use the tissue and dump it in the trash. But if you are wearing the mask, then immediately replace your mask and wear the clean mask. This will prevent the droplet infection. So you have to always cover your nose or wear the mask to prevent the droplet precautions. Next one is the airborne precautions. For airborne precautions, it is very important to wear the mask as the COVID virus is going on. Please avoid going to the crowded places, as well as wear the face shield and the mask so that you cannot catch the airborne disease. Next one are the contact precautions. Whenever you are in hospital or in the community session, or you are doing any medical service, always use the gloves because you can come in contact with any type of blood or a bodily fluid that may cause the contact infection, or avoid touching the handles in the public places, and always wash your hands and use the sanitizer so that you can avoid this type of disease or the infection caused by any type of contact. Thanks for watching this channel. I hope you like this video. If you like this video, please subscribe to this channel and don't forget to press on the bell icon so that you may not miss any of my video on my channel. Thank you so much.